Hello, everyone. Thank you for joining our Facebook Live on COVID-19 vaccines. My name is Dawn Mountner, and I'm a family physician and senior health advisor for the Oregon Health Authority. I'm joined this morning by Dornbecker pediatrician, Dr. Antoine Chavez, and Oregon Council on Developmental Disabilities staff, Lynn Russell. Both have received the COVID-19 vaccine and will talk about their experiences getting vaccinated. First, let me start with a quick update on where we are with distribution of the two available COVID-19 vaccines, who is currently eligible and who will be eligible in upcoming phases of the vaccine distribution effort. As of February 17th, Oregon has received 922,300 doses of vaccine and administered a cumulative total of 707,244 first and second doses. Severe weather has been delaying COVID-19 vaccine shipments across the country. While these weather-related issues may cause changes in the amount of vaccination we receive, we remain in regular contact with the Centers for Disease Control and Prevention, the CDC, to ensure Oregon doses are safe. As of February 15th, adults over the age of 75, individuals in Phase 1A, and education and childcare staff are all eligible to receive a COVID-19 vaccination. Oregon continues to expand the ways people can get vaccinated. This includes distributing vaccines to local public health authorities who work with local providers to get shots in arms, mass vaccination clinics such as those at the Oregon Convention Center and similar sites in Deschutes, Jackson, Lane, and Marion counties, sites that can handle a large number of patients, such as federally qualified health centers, tribal health authorities, and leveraging the federal retail pharmacy program, which has partnered with 21 national pharmacy networks to increase access to COVID-19 vaccinations. We also continue to respond to feedback about how access can be improved at our large vaccination clinics, including separate lines and waiting areas with fewer steps for elders and those with mobility impairment, language support with those with limited English proficiency, wayfinding staff to help people access any specific supports they may need to get vaccinated at these mass vaccination sites. New vaccine appointments are available at the same time, 9 a.m. on the same days, Mondays and Thursdays, for people who live or work in Multnomah, Washington, Clackamas, Columbia, and Marion counties. The new appointments can be accessed via the Vaccine Information Tool or chatbot at covidvaccine.oregon.gov. Eligible Oregonians in other counties can check for vaccine information in their communities by registering on the Get Vaccinated Oregon tool or checking the county resources link at covidvaccine.oregon.gov. Starting Monday, February 22nd, adults over 70 will become eligible for COVID-19 vaccination, and adults over 65 will become eligible starting Monday, March 1st. Subsequent groups will be determined in coordination with the Vaccine Advisory Committee and shared on OHA's COVID-19 vaccine webpage. Examples of these groups of people who may be included: critical workers in high-risk settings, workers who are in industries essential to the functioning of society and substantially higher risk of exposure, people of all ages with underlying conditions that put them at moderately higher risk, and the general population. We appreciate the enthusiasm for the vaccines. We encourage everyone to be patient as we work through this process and ensure those most at risk for infection and for serious illness or death can get vaccinated. In the meantime, everyone should continue to practice those important prevention measures we've talked about so often over the last year. Please wear a mask, practice physical distancing, avoid gatherings and travel, wash your hands often, and stay home if you're sick, and get the vaccine when you become eligible. Thank you. And Dr. Chavis, the floor is yours.
Thank you. So again, I'm Antoine Chavez. I'm a pediatrician and assistant professor of pediatrics at OHSU. And I have been vaccinated. I've received both of my doses, and I was very happy to do so. In general, identify as African American, and within my community, I know that there's a lot of hesitancy with getting this vaccine, which is fair. The institution of science and medicine has not always had the best interest of the Black community at heart. But I, present day, believe in science, and I believe that this vaccine is safe. I know it was kind of made in a way that people find question about in terms of how fast or how tested it is, but it's really been proven to be pretty effective. And as a nerd, like the science behind it's actually really exciting. I think that the issue with COVID is that it's not a fair disease in the sense that, I mean, it's fair in the sense that it's a burden more to the adults than kids, which makes sense. We want to protect our children. And so it's kind of nice to know that the adults kind of take the burden of this disease, but it is disproportionately affecting people of color. So people that look like me, people that have underlying health conditions, and people that don't. The hospitalization rate, speaking as an African American about African Americans, our hospitalization rate is like 3 times what white Americans is, and our death rate is twice as likely to die from COVID, the same disease that a white person might get, and I would be twice as likely to die from it. There's a lot of kind of question and information in the background about what might be associated with that, but either way, the vaccination for me was a way to protect myself and make sure that I can keep myself safe. I have a high risk job and I have a stressful job, but it's a job that I want to be able to keep doing. And so the vaccine was a welcome opportunity to keep myself safe. And I hope that other people in my community and people outside of my community, people in general, all Oregonians feel and trust in the science and get vaccinated themselves.
Thank you, Dr. Chavis. Ms. Lynn Russell, would you care to share with our audience your experience?
Sure. Thank you, Dr. Mountner. My name is Lynn Russell, and I work for the Oregon Council on Developmental Disabilities. And so the council has been really involved in vaccine access for the developmental disability community. But I am here today to share my family's experience with the COVID-19 vaccine. My son Liam is 16 and he has a neuromuscular disability, and he shared his story in Vaccine Voices just a few weeks ago because he felt it was important, and I do too, that families like ours see themselves represented in Phase 1A. We got our vaccines because Liam is high risk for COVID complications, and we have been doing our part by staying home and masking for almost a year now. We wanted to feel that he was protected and one step closer to being able to go back to school in person and to see his friends. He has spent his junior year of high school in distance learning. So my husband and Liam and I received our second Pfizer vaccines 2.5 weeks ago now. And of the 3 of us, I was really the only one that had side effects, but I knew that they might happen and that they would be a normal immune response. So I was not that worried. I had a low-grade fever, aches and fatigue that started about 12 hours after my vaccine and lasted for 24 hours. And after that, I felt fine. And so I would want my fellow Oregonians to know that parents of children with medical conditions or disabilities are eligible. And if your child is 16 or 17 years old, they can get the Pfizer vaccine like we did.
Thank you for sharing your experience. I know that a lot of folks have concerns about those experiences, and hopefully this will offer an opportunity both to understand what we expect, understand how the body's natural immune response is being activated so that you feel a little bit yucky, and also get the information that folks need to be able to make this decision in an informed way for yourselves and your families. And I would offer the floor back to Dr. Chavis if you would like it, and otherwise for questions.
Hi, this is Jonathan with Communications at Oregon Health Authority. We'll now open it up to questions. Just a reminder that this is a Facebook Live on COVID-19 vaccines, so we won't be taking questions on other topics at this time. To ask a question, please submit it to the chat. The first question is from Marlene. When will people with compromised immune systems be able to get the COVID vaccine?
We recognize that people with compromised immune systems are at greater risk from COVID-19, along with a lot of the other individuals that are in Group 1A. It's part of the sequencing question is being addressed by the Vaccine Advisory Committee to try to do an equitable job of distributing a resource that is scarce at this time. Right now, our demand outstrips our supply, and it's wonderful that that so many want this vaccine. We're doing our very best to navigate that tension between making it available in these mass vaccination sites that are very easily accessible to a portion of the population, and then targeting our outreach to try to reach to folks who have potentially more difficulty accessing or navigating those sites, or who are going to need to be reached somewhere closer in their community. But the sequencing is being determined in consultation with that Vaccine Advisory Committee in order to try to maximize those equity questions. And we should have more input from them shortly as they have done their deliberations and provided their recommendations, and that process is coming along. I'm sorry I don't have all those answers right now.
Thanks, Dr. Mountner. The next question is from Dina. Was the vaccine tested on disabled people in the trials?
I don't have specific numbers on that, but I can get them. Whatever is available, I can bring that back. Sorry, I don't have that at the tip of my tongue. If the other speakers have that.
And I don't know of the specific like underlying conditions that participants had. More an idea of like the racial distribution and like the amount of people that became pregnant during or after the trial, but otherwise I don't have any other information either.
Thanks, Drs. Mountner and Chavis. The next question is from Margaret. I hear the second shot is worse than the first. Is that true?
I could talk to that. I think it depends. Everybody reacts differently to the vaccine. And so, like I said, for my family, the second one was a little bit worse for me, but not for everyone else. And I would point out that it can be an indication that your body is mounting a good immune response, but if you don't have that reaction, it doesn't mean that the vaccine isn't working.
Thank you, Lynn.
And I can add to that as well. It depends a little bit too on your past exposure. So for some people, if they naturally got coronavirus already, their first vaccine might have a more pronounced response than someone who's totally naive to it, who's never seen it before. The second time you get it, the body because after you get your first response, either through the vaccine or naturally, your body creates a response to say, I don't know what this is, but I'm going to learn about it because I don't think that I like this thing. And then the second time it sees it, your body says, I said I didn't like this, like, let me get rid of it. And so as it's kind of doing that, you kind of have a little bit more of a robust response. So some people get that first time if they've already seen coronavirus naturally before. The second time that I got the dose, for me, honestly, it wasn't as bad as the first time. I, like all men, am slightly hypochondriac. And so after the first dose, I think I expected to feel a lot worse. And I had a little bit of a headache. I had some chills. I took ibuprofen, went to bed, and I woke up fine. The second day, because I kind of had an idea of what to expect, I didn't feel quite as bad. I didn't even take off work. I didn't feel at my baseline, but you know, a dose of ibuprofen and bed was all that it took for me to feel better the next day.
Thanks, both of you. The next question is from Martha and Madeline. They ask about drive-through vaccination clinics and what's being done to create more of those.
I know that we are in talks and considering lots of different ways to get the vaccine, make it more available to folks, particularly the mobility impaired in that particular case, maybe well suited for drive-through clinics, but even the larger mass vaccine clinics are trying to tune into the needs of the mobility impaired and people with lots of other needs, language needs, and sort of with navigators to help get people the support that they need to be able to access shorter lines, wheelchairs on site to support folks who don't walk as well, separate waiting areas, additional space, even some shorter lines and separate entrances for folks who are potentially having trouble accessing care in those big sites. But we're in talks about some drive-through clinic opportunities.
Thanks, Dr. Mountner. The next question is from Jennifer. My mom got a vaccine, but didn't get a vaccine card. Where can she get one?
I don't know the answer to that. My suggestion would be to go back to the provider or call back to the provider or go back to the site and make that request of the individuals or the site where the vaccine was administered.
Thanks, Dr.
And
sorry,
I agree. So whenever we administer vaccines in the state of Oregon, we typically register. We say that we gave the vaccine through like an Oregon registry. And so that information should be easily printable if they just need a date and time of that they received the vaccine. If they have a more specific question about like the lot number or the specific type of vaccine, that would be easily traceable from the site that they received the vaccination from.
That's a good point. And that information is available statewide should somebody show up at a different site, for example, for the second shot than for the first shot. That is the alert immunization registry, and it's shared across providers so that it's the same system that we use for all the rest of the immunizations, which is nice because everybody already, lots of folks already know how to use it and access it. That's a good point.
Thank you both. Next question from Tracy. My kids say the vaccine isn't safe. Is it?
Dr. Chavis?
Yeah, I mean, I think, I have faith that the vaccine is safe. I think it depends on your idea of safety. Will you get the vaccine without feeling off of your baseline? Probably not, because most of us do have some degree of, of headache or muscle ache or sore arm or something. It's less than what I would say you would experience with COVID in terms of the severity and duration. But in terms of safety, in terms of long-term effects, as far as we know, we've got no reason to think that it's not safe. And most organ providers wouldn't recommend it with such enthusiasm if we felt like it was not a safe thing for other people to get, including ourselves.
Thanks, Dr. Chavis. Oh, go ahead.
Sorry, I just wanted to get a couple different angles on this one. Lynn, did you have any thoughts on that?
Sure. I think it's safe. I would not have my family vaccinated if I didn't believe it was safe, if I didn't believe in science. And I think when I weigh the risks of contracting COVID against the very slim chances of a negative response to the vaccine, then the choice is really clear for me to get the vaccine.
That was really useful framing, Lynn. I liked how you compared the risk of the vaccine to the risk of the illness. And if you think about the impact the illness and the infection and the disease has had, not only on our individuals and our families, but our communities and our society, the vaccine has its risks, right? 94, 95% protection isn't complete protection against illness. However, it has a remarkable 100% protection against death. And we don't typically see that. And that's a really good outcome right now. Of course, we're working with shorter term data. We don't have the very long-term data, but the question is not, is getting the vaccine less safe than not getting the vaccine? It's, is getting the vaccine less safe or more safe than getting the illness and the impact that COVID-19 is having? And when you frame it that way, I think it puts the risk into a different category. And while, yes, we do have some very severe reactions, right? Anaphylaxis is a potentially life-threatening reaction. And we do have some illness, perhaps for a few hours or a couple of days, some feelings of muscle aches as our immune system ramps up and those inflammatory processes identify that mRNA, those pieces of genetic material that can be linked to the virus. Taking a couple of days to recover from this, to put yourself and your family in a better position to fend off the potential impacts of the disease, is a really good risk-benefit comparison from my perspective as a family physician, also as a mom and a daughter to elders who both have underlying conditions and are at grave risk from exposure to this disease. And we're very excited that they have been able to get a vaccine, even if some of the rest of us haven't got ours yet.
Thanks, Dr. Mautner. Next question from Northwest Family Services in Espanol. For people who think they will be receiving a less effective vaccine, such as Johnson & Johnson down the line, what would you tell them to reassure them and convince them to get vaccinated? Dr. Chavis, do you want to tackle this one?
Sure. I think that there is some hesitancy in terms of the Johnson & Johnson just because of the numbers in terms of, 65, 70% effectiveness versus 94, 95% effectiveness. Either way, the number is better than zero. I think that it'll be more available. I feel it's been safely tested enough to show that it's beneficial. And I don't know that I would have as much, I understand the hesitancy in terms of wanting, if you're going to do the thing, if you're going to be brave and get vaccinated, you want to get the one that you feel like is the most effective, which I think is fair. And I don't know that there will be I don't anticipate there being a hard stop in terms of if you want the Moderna or Pfizer. I feel like there are ways to eventually wait, and eventually that will be available if you feel like waiting. But I don't know that I would recommend it over getting the Johnson & Johnson whenever it's available to you, or any of the vaccines that may come down the line that might be available first. If their effectiveness is found to be good enough that they can be mass produced and distributed to whoever needs them. In terms of safety, I feel comfortable with that. And in terms of effectiveness too, I imagine that the people, I think the biggest goal is to decrease the degree of mass casualty and death and of scary things like that. And I think that the Johnson & Johnson vaccine will still do that. Whether or not it'll be a for sure way to keep you from having, significant symptoms, it is statistically less likely, I suppose, but still pretty likely to be beneficial to you medically. So I don't know the best way to answer that question, but I would not have any hesitancy against the Johnson & Johnson just because it's less effective, because it's still more effective and safer than just getting coronavirus naturally.
Thanks, Dr. Chavis. This is a question from Kimberly.
Jonathan?
How is it safe? Oh, I'm sorry. Go ahead, Dr. Mautner.
Sorry, I don't know if Lynn had thoughts on this.
Oh.
But I do have a couple of thoughts. One is that Johnson & Johnson vaccine is being tested in an environment that is different from the environment in which the Pfizer and Moderna vaccines were tested. The new variants that are coming around that may be able to avoid some of the targeting of the vaccines were not in the community at the levels that they are now when the Pfizer and Moderna vaccines were being tested. Also, those are 2-shot vaccines, and the Janssen vaccine is Johnson & Johnson and Janssen are the same vaccine. Sorry if that's confusing. The Janssen vaccine is a 1-shot rather than the 2 shots of Moderna and Pfizer. And we have yet to see how any of those things may play in. That is to say, if the Pfizer and Moderna vaccines were tested in today's environment, it's not clear exactly what their numbers would be. What we do know is that all 3 of those vaccines decrease the likelihood of severe illness or hospitalization, and they all do a really good job of preventing death. And at the end of the day, the best vaccine is the one you can get. So please get whatever vaccine is available to you now. And if it turns out that we need to do reconsideration down the line for additional vaccines, we even have some trials going that are mixing and matching vaccines to see if combining different versions of the stimulus for the immune system might be helpful. So we have much left to learn about all of that, but at the end of the day, the Janssen vaccine is going to be way better, just as Dr. Chavis said. It's going to be way better than getting the infection. So if it's available, it's a good vaccine to get.
Thanks, Dr. Mountner. Kimberly asks, how is it safe for my 18-year-old to go back to in-person education when they haven't been vaccinated? How do they not infect us at home?
Just letting the interpreter finish. So there's a few communities have already kind of allowed themselves to reopen in terms of in-school learning, and this is like this whole other conversation, which I would love to have at any point. But and they have found that the rates of transmission between students and from students to teacher and vice versa is not any higher than it would be just like in the general population. And they found they weren't actually exchanging the virus as much as I think people were anticipating. And that's because schools, in order to reopen, have to follow such strict guidelines. And schools that are doing that don't actually have more significant spread of the virus than was seen in just the general community. So I think that the hypothetical risk is fair, depending on the amount of socialization that happens outside of school. But in terms of the learning that happens within school, the rates of transmission aren't high enough that it should theoretically deter children from going, especially if they thrive better in an in-person learning environment.
Thank you for that, Dr. Chavis. I also want to note that of the cases that we've seen in schools in Oregon, the vast majority, and when I looked, it was actually every case of outbreak within the schools that we've seen in Oregon for schools that have been open. The transmission was primarily happening from outside, and then a case would be detected in the school because of the testing, but it wasn't being transmitted or spread within the school. They would close the cohort, send the individuals home and do the quarantine, those who had been in contact, but we're not seeing much in the way of spread within schools. We are seeing children, students, and teachers bring the occasional case into a school, but then the transmission winds up mostly being halted in that environment. So there is an opportunity to do it in a safe way. We've seen some very good evidence out of states that have done some very careful experiments in terms of what the precautions need to be in order to protect our kids and our educational staff, and also that needs to be balanced with the risks and dangers of students not going to school, which is something that we haven't done as good a job of quantifying as we are doing of quantifying COVID. But there are enormous impacts of not going to physical school on kids, from the mental health impacts on the children to the strains on families, including working families who don't have childcare in place or an educational opportunity in place that allows them to continue with their working. So the risks of keeping students at home are great and need to be those that we are comparing against the risks of sending kids back to school.
Thanks, Dr. Mautner. Last question is from Martha. Do we need a booster in 3 months?
The vaccines that we have their timeframes laid out for us in the ways that they have been designed and studied so far. We do know that there is a variation going on in the virus across the globe, and that some of the variants are potentially able to avoid the vaccine. So it is possible that we will want or need to tweak these vaccines and come back around in the same way that we do with the flu shot over time to address these new variants. But we don't have enough evidence yet to say definitively what we're going to need to do. We will do our very best to keep you updated on the latest evidence and on the ways that science is able to race with the variation that's occurring in the virus to get vaccines developed that can protect against any that do occur.
Okay, thank you, Lynn Russell, Dr. Antoine Chavez, and Dr. Don Mountner. And thank you everyone for joining the Facebook Live today, and have a great rest of the day.